Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing a weekly COVID-19 update for January 14th. Falmouth Health Department, you can email us at health@falmouthma.gov, call us at 508-495-7485. And our website is falmouthma.gov. We do have a COVID page. We'll put some of this information on there every week. So we didn't have another good week. We definitely did not. So our total case count is 3,488, which is 314 confirmed for this week, and 105 probable. Our 14-day daily incidence rate is now 149.80. That's basically how many cases we would have every day if we had a population of 100,000, and that's averaged. State gives us just a little bit of delay, so this is from 12/26 to 12/8. It'll go up probably for the next, or be pretty flat, I think, next week. I'll show you in a sec. And our positivity rate is 17.81. The state, I think, is somewhere around 20. Same time frame. So here's our case counts by the week. You can see that we've had 1, 2, 3 horrendous weeks. It is less this week. 1 week doesn't make a trend. Hopefully it happens again next week. I've seen in the last couple days a bit less cases, so hopefully we've sort of peaked. There was an article in Boston Globe. They test wastewater, MWRA, and they're seeing a decline in COVID in the wastewater, so maybe this is the peak, let's hope, and we're starting to come down. But we'll see, because if you look back in February 2021, you did have a couple weeks that were up, and then we, down around January, went down a little bit, but then jumped up, so that definitely can happen. So I wouldn't say it's necessarily a trend yet, but let's hope. This chart, again, tighter the circles and the flatter the line, the better we're doing at that point in time, and this is off the hook high, so you can see the spacing. Case counts are jumping rapidly and increasing sharply, so hopefully that's plateaued. Same thing here for the county, similar. They had a higher case count up till right around and earlier in the month, and then there's been a day where it's a little bit lower, so hopefully that was sort of the peak, which would make sense because a lot of holiday testing, a lot of holiday travel, a lot of holiday get-togethers, a few days to a week or 10 days later, that's where the spike is. And so hopefully that's what we see, and we start seeing a downward trend. It'll take a while regardless for it to come down from these numbers. It's not going to happen immediately. It's not going to jump back down to 50 like next week. So I think it's just going to take a little time to get that back down. Now, talk a little bit about what this means for cases. So back up, let me go back up with slides. You see the case counts around, I'm circling it in the green. You see somewhere around 400, 300, 400, 3 days. That's 3 days worth of cases. That's a 3-day period. And you see deaths up here at that point in time in the teens. So you're not seeing that over here at the far right. So you're seeing cases, all things being equal, if all things were equal, since we're, 3 times at least that case count. And again, going back, I wanted to emphasize this before, this is all just PCR. Going back up to here, this is PCR. This is not accounting for home tests, so this number is going to be some number really much higher than 300, 400 cases a week. Just want to let you know, because again, this is PCR. It's all relative to PCR. We're testing about the same number of PCR, somewhere around 1,900 PCRs tests a week. It's sort of similar to what maybe back in here. So we except when it gets really low, PCRs drop. So that being said, compared to this, just compare the chart to itself as opposed to what's the actual case number. I can no longer report an accurate case count with home tests because they do not go into the system. So coming back to here, with this number being actually much higher up, again, it's using the cursor, it's circling up well above 1,200 for the 3-day average. It was well higher than that because, again, it doesn't count home kits. The death rate would, if it was the same sort of situation, would be much higher, and you don't see it. Now, there's a lagging indicator for deaths, but it's not showing an upward. It showed a slightly, going from 2 to 4 and staying in that 4 to 6 range for 3 days isn't showing a proportional amount of increase, and you'll see that in the state trends as well. So, we'll talk about that in a bit. Hospitalizations, 15 and 4 on the 11th. On the 5th, it was 14 and 4. A lot of these could be the same people. So the hospitalization is going to be high just by the sheer number of cases, and of course, we don't have everybody vaccinated, so these numbers will stay high. But right now, it's 17% of ICU beds occupied and 12% of total number of ICU beds occupied. So we're not. We're not at 90% or anything that number right now. So let's go to last year. So I put this up last week too. This is 2021, so this is last year, And you see the highest the ICU beds were occupied was 36, and that was on 126. So we don't necessarily at this point in time, I don't see it in this year's numbers to see that we're going to match the hospitalization rates. And that's mainly because we've been vaxxed and boosted since then. Back then we had guidance, we had mask mandates, and we had, sitting 6 feet apart and all that stuff that we did in 2020 into 2021, till May of 2021. You would still see hospitalization rates. And that's with a weekly case count of 80, 90, or 100 PCR, and most tests being PCR. Now you're getting 350 PCRs plus some unknown number of home tests. Let's double or triple it, maybe double it. But the hospitalizations are not getting to 18 in the ICU. Falmouth was similar, 10 and 5. Cape Cod had much higher. They were going through a big outbreak then. That worked its way to us. But that's where Omicron being less likely for hospitalizations, and also the boosters and the vaccinations have been what's really changed it, and brought that number way up. In the state, 18,000 cases for yesterday. It was like 25 last week at the same time. Positivity was 20% for that time frame. If you look at these trends, you see the sharp spikes up in hospitalizations, up in positivity went way up, cases went way up. You don't see it inherently with deaths. We treat it better. We have vaccine boost. That all keeps you from that point. But you see that the trends have gone up significantly. You do see a drop, at least in positivity in cases over the last maybe week or so, but let's hope that continues. Looking at Falmouth, this is for a time period of December, right after Christmas, to December 26th to January 8th. You see an incidence rate of 149.8, which is somewhere in the middle, maybe slightly higher than a lot of towns. So we're in the ballpark where other towns in the Cape are for its positivity. For its incidence rate and positivity similar. We're all sort of bunched up in the teens. With Falmouth being 17.81, the state was 21.52 for the same time frame. Okay, so it's about the time frame, and this was for between, again, the 26th and the 8th. So again, very, very high numbers. I think everybody knows that. Getting back to my original, what I'm trying to get at is that, it's not 2021 or 2020 that hospitalizations and deaths among boosted and vaccinated people are, and with Omicron being generally having less severe outcomes. So an individual person has less likely, if they've been vaxxed or boosted, to have a serious outcome with Omicron as opposed to Delta. And add that would be, freshly vaxxed and boosted, or maybe not freshly vaxxed, but freshly boosted. The number of hospitalizations and deaths among vaccinated people, that percentage is actually dropping. So last week it was 179,594. We've jumped to 262,000, so about 80,000 people this week who were vaccinated. This is vaccinated. I don't think it discerns from that and boosted. I think it's just vaccinated because it doesn't clearly say boosted in here. Okay, so you'll see an increase of about 600 about 600 people were hospitalized. That percentage was 2.18% last week. It's down to 1.74. So why would this number should be going up if it's further away from your vaccine? It's because Omicron, again, less hospitalizations, and the boosters are working. So boosters and Omicron being different from Delta as far as hospitalizations. The reason why I think this number is down at 1.74%. So 1.74% of the 262,000 people were hospitalized. The death has also been cut roughly in half from when they first started showing this chart in October, I think I started to put it on there. This number used to be around 0.8, and this number was around 3.8. So these numbers are dropping. So the hospitalization rate and the deaths among vaccinated people is getting less every time they show this chart every week. So again, as an individual with Delta, and we'll talk about how Delta is more prevalent with Omicron being more prevalent than Delta, you can see that an individual's outcome or likelihood of getting severely ill if they've been vaccinated boosted is less with Omicron and with the booster. Sorry to ramble. So here's our vaccination rate. So we've gained, it only shows like 6 increase from last week. I think what happened is they probably had too many into the first dose, and when they cleaned it up, they had should have been in the booster dose. This comes from the state. I just write the numbers down. We had 775 booster doses in 1 week. It could have been also that they took some of these out from the previous week, and maybe sometimes the pharmacies write down first dose, and it should have been boosters. I don't know. I just write the numbers down, honestly. So all you need to know is we're well vaccinated. 82.5% of all eligible residents are fully vaccinated. So 79% of the town, 82.5% of eligible residents. About half the county is boosted. Falmouth's at 43% of the population totally boosted. So that's where we're at. And we keep making increases in it. You see that we've done some booster clinics at the schools. I think that's where you get that 6% increase in the far right, the 20% for 16 to 19, and 3% increase of 12 to 15. Part of that might be, we offer a lot of clinics at the schools, chances to get vaccinated, and if you're eligible, boosted. Vaccine availability and testing. Vaccine, again, VaxFinder, Mass.gov, the pharmacies, Barnstable County, Convenient MD, Community Health Center. Homebound should be calling the health department. I'll say that every week. If you know someone that's homebound and they're looking and they want to be vaccinated for the first time or boosted, we can take care of that. We send out a visit. VNA stands for Visiting Nurse Association, so that's what they do, and they'll take care of that. And we still have the clinic at the Gus Canny on the 19th. There was yesterday still a few openings. If it doesn't fill, I may not run as many clinics. Maybe I should do a better job advertising it. We'll try to do a better job. But we will run more clinics. We'll just see if we still have enough people that want it. But we have one at the 19th, which is Wednesday of next week, the Gus Canny. And we had a couple, as of yesterday afternoon, there was a handful of appointments open. But you can get that right. If you go to the Town of Falmouth's website, you click on the Health Department page, and it's under the Health Department page right at the top. So when you click on departments, click on Health, and the clinic link is right there to register. It's an online registration program. So again, VaxFinder is still the place to go to do to search for that. Testing, still the school-based test and stay. It's quite a monumental task for the school department. There's Convenient MD, CVS. The hospital is supposed to be expanded. I didn't get a ton of information yet. I haven't found anything where they've actually started to expand it. You can get good information from the Barnstable County's website. The fairgrounds, again, check the Barnstable County's website when the fairgrounds will have the next round of free testing. Community health centers, there's lots of home tests. Home tests are great. Just remember that they're not contact trace, so we're not going to call you. We're not going to know. You can let us know that you were positive. We're going to send you the isolation and guidance that you can actually just get from the CDC as well. But the home tests are good. It's just, right now, again, they're not going to show up in these particular numbers. So, and then, of course, the Stop the Spread site has been open now for over a week, I believe, or at least a week. And that's state-run at the Melody Tent, and Mondays 9 to 1, Tuesdays 1 to 6, Wednesdays 9 to 1. Also, Barnstable County's got a really good website. It is linked through our website, Barnstable County's, but they have all the information on there. So Barnstable County Health is their website. So you can do that or find Barnstable County's health website through the Town of Falmouth's website. And, of course, if you have questions about them, you can call the health department. Booster doses, again, booster 12 and older. Okay, so we don't talk anything about that. But if you can't get online, you have trouble, you can always dial 211. Okay, you are allowed to mix vaccines, so nothing's really changed on that this week. Okay, it's just 12 or older. At least, I think I just changed to 5 months. I should have fixed that, 5 months. And then J&J is still 2 months. So that should be fixed. Just got to double check it, but they were talking about moving it to 5. I think that's done. So we're at that. That's where we are with that. Isolation and quarantine guidance has changed. It's gone from 10 days to 5 days. We stay at home for 5 days. If you have no symptoms, your symptoms are resolving after 5, you can leave your house. If you have COVID, continue to wear a mask for at least 5 days. If you still have a fever, continue to stay home. So that's the guidance if you have COVID. And if not, they treat those that have not been boosted like they treat those that are unvaccinated. Stay at home for 5 days. After, continue to wear a mask for another 5. If you can't quarantine, you must wear a mask for 10 days. Test on day 5 if possible. If you develop any symptoms, get a test and stay home. That's the key. If you get symptoms, stay home. If you've been boosted, wear a mask for around others for 10 days. Test on day 5. Any point in time you develop symptoms, you should isolate yourself. Okay. There's our other things going around. But that's the guidance. And so you can also get that on, if you go to the COVID page, right at the top of the COVID page where I put this presentation, right above it, I put the CDC's isolation and quarantine guidance. if you want to get the popsicle headache and read that through, but, you know, you can always call the health department. We'll walk you through it. Okay, this week something new is myvaxrecords.mass.gov. So this is what the website looks like. On the left is the first page. Click on Find My Vaccine Record, access my vaccination records, name. Click on email if you want email, or text if you want text. Here's the only thing I can see about this. I'm not quite sure how good the search engine is. You know, if you did your vaccine as, you know, with your middle name in there and you don't have your middle name in there, that might be a problem. So just, you know, you might have to search once or twice. If nothing comes up, then I think maybe it's the way the name was spelt on the card. Again, if there was an error on the card, I don't know how good that sort of search engine is. I'm not looking for my Vax card. I guess I should do that with my information. But, you know, Mary Smith, you know, whatever it happens to be. But if your name, you know, for some reason hyphenated, you know, that kind of stuff can happen on a search engine. So just be careful. You might have to try it a couple different times because you may have had your middle name or something in there. Or, you know what I'm talking about. So you fill this out, birthday, gender, and then they'll make you create a PIN number for you to remember, and then you hit submit, and that's it. So I guess then it'll send it to your email or text you that information. You can print it out. Or, you know, you'll have an electronic copy, which you could either print out or keep on your phone or keep on your computer. There's a frequently asked questions page that you could do, okay? It says down here, note, the information in your MIIS. MIIS is the record keeper of all the immunization records. All your immunization records are on MIIS. Is collected from your healthcare provider. Enter the information you gave your healthcare provider to improve your match rate. And that's what I meant at the previous slide, is that, you know, I think if you're having a problem, it might be the search engine with your first and last. You know, my third letter is capitalized. If I type it in and it's not capitalized, I don't know how sensitive it is for those things. And that might be where some people might be having a problem or not. Again, so just you might have to try that a couple of different times. Hopefully they didn't put it in with the wrong last name. Like if they spelled my name MCC instead of MCG, then it's just not going to find me. And so that's where maybe some people are having problems with spell. You know, the data was put in incorrectly, and not by you, by someone else. Again, so there's a frequently asked questions that you can go to. So as far as where we are with what's going on with which variant, we're at all Omicron. See, it's almost pushing 100%. That just keeps going up. And so Delta being orange and Omicron being blue, you can see since about Christmas time, it's really been the primary, and now it's just about all between 94 and 97% of cases are Omicron. If you get a PCR, they don't go and tech you whether you're Omicron or Delta. What they do is they do a statistical amount of testing because it's a specialized test to determine. PCRs do not detect whether one's Delta or one's Omicron. It just detects COVID. So they'll have to sequence that at a lab. It's very specific. So what they do is they'll pull a subset. So they might have pulled, let's say, 1,000 tests and found that 995 are, and then that's where you get your percentage from. So it's definitely, Omicron seems to be definitely more transmissible. Look at the case count since Omicron hit, right? Our case counts went up right about then. So that makes total sense. It's outcompeting Delta, which could be a good thing in the long run. If it, you know, again, the next variants, you know, we'll have more variants will be based on Omicron, then perhaps there's a shift more towards the upper respiratory because it does appear more of a sore throat, more of an upper respiratory issue. Doesn't mean it can't be in the lungs. It doesn't mean you don't get off, but I'm saying it just seems to be more upper rather than the COVID pneumonia and the real deep cough that Delta would be. And that's, I think, where you're saving it with the hospitalizations and so forth. So, you know, hopefully that we find out in the future that, you know, the Omicron shift from Delta was actually not a bad thing. But we don't know yet. We don't know. So it's generally producing, at least from the hospitalizations and the death rates, less severe outcomes. And boosters seem to be quite effective with Omicron. Again, face coverings. The entire town's on a face mask advisory from May. The Board of Health on the 3rd, their January 3rd meeting, requested that the Select Board adopt the mask requirement in town-owned properties as a show of how important mask wearing is. Masks, in my opinion, do lower the transmission rate, especially if they're a decent mask. So they do help. The board did not decide to do a mask mandate for all. So there's a few towns that have mask mandates for all in all indoor spaces. They asked for town-owned properties and a recommendation that, private businesses consider the same. A private business can consider that, if they want it, it's their business, they can have it. So there's a mask requirement here in Town Hall. That was as of this week. Okay, so that's something that's new. Our metrics are horrible. Everybody's horrible. We're high. Anything over 100, we're at 1,000, so we're just high off the charts. Everybody's off the charts since Omicron hit. Luckily, hospitalizations, though high, I mean, Cape Cod's really high with 45. We're not having, we're not proportionate to the number of cases. Again, if we were getting that many cases without a vaccine, this hospital, I don't want to know what that number would be. It'd be a horror show. So, vaccination rates are good, again, are very strong. This is the same slide as last week. Falmouth cases are highest ever, and going to continue for a while. It's going to take a while to come down from this. 95+% of Omicron. When you make decisions about going out and things of that nature, consider your vaccine status. If you've been vaccinated, boost, or if you haven't, you got a lot of underlying medical conditions, and you're not vaccinated, and you don't wear masks. Well, eventually you're going to get COVID. Hopefully, it's the Omicron, and that's what most likely. And hopefully, you have an easy go of it. But again, personal responsibility on how you take care of things. Vaccine eligibility is 5+, doses are 12+ for boosters. You're way more likely to get COVID. I still check that. Still mostly people that are unvaccinated show up more often, even though there's so many more vaccinated people than unvaccinated. Even 50-50, even if we had 50% of the cases were vaccinated people, look, there was like 80,000 cases. So there's a lot of breakthrough. Again, it's still a higher proportion of unvaccinated people get it than vaccinated people do. There is updated isolation quarantine guidance. It's been reduced. It's more up to the individual now. There's not a lot of contact tracing that happens from the health departments anymore. And state no longer has the CTC. Towns are doing it themselves. It's more about we basically send you the guidance. We don't start calling your aunt that you were with and your cousin. When we start getting into the contact world, that stuff's been taken away. We couldn't really be hard to manage 400. That would be, a couple thousand calls. Home kits are readily available. I know the school's working on getting some. We were not one of the towns that got the home kits for free. There is a mechanism for municipalities to purchase them. But right now that the home kits are something that the government's been promoting. Again, they're not contact traced. They're off the grid. They're not on our radar. But if you do use a home kit and you're positive, then you would follow the isolation and quarantine guidance. If you have symptoms, you probably should grab a second. If you've got one of these tests, you were negative, but you've got symptoms, especially sore throat, upper respiratory, or coughing, or any of those, any of these respiratory. They do recommend a second home test 24 to 48 hours later. And the reason being is if you're positive, you're definitely positive with one of these test kits. If it's early on or very late in your battle with COVID, then sometimes these home kits can be false negatives. So they recommend if you're going to do it to follow up with either a PCR or a second home kit 24 to 48 hours after that last test, if you want to be, to be quite sure. And there's also going to be more testing options soon. Okay, so that's, something I've had on there for a couple weeks. I just don't have any more information on other than the Stop the Spread site. Again, you're much more likely to get COVID. If you're unvaccinated, you're way more likely to be hospitalized and in death associated with COVID, though less so with Omicron, but I wouldn't just let my guard down and say, Omicron's just the sniffles. It's not always for everybody. And, we do have people in the hospital. And so, again, that's a decision you need to make. It's up to you. And so that's my update for the week. And I will see everybody hopefully next Friday. Thanks.